But we are very committed to what we call our Healthy Active Lifestyles Initiative, and that's addressing issues that we can address with minimal effort in our communities. That's drinking more water, that's walking a little bit more, that's deciding to put something in the oven versus in the grease, little easy things that we can kind of fix as we move forward. But we're also going to dive into some lifestyle changes through some of our strategic partnerships. And so I'm happy to have Ms. Patricia Embry, who's provider relations with contracting with, the provider relations contracting with consultant, Medicaid, Blue Cross Complete. All right, some things just don't sound right, but I know you're going to make it whole for us and bring it all back together. So please welcome Ms. Embry.
Yes, thank you. And to make that, he said all of that to say, I'm just a provider rep. So, and basically, Camille, excuse me, can you just hit that just a little? First of all, I want to just thank you for allowing me an opportunity to come here. And Angela definitely likes to cart me around and to tell our story. And I'm glad to do that. United Way, you're fantastic. And we want to definitely talk after this. Thank you. But how many of you know that Blue Cross has a Medicaid product and is in Healthy Michigan? Anybody? Nobody? Okay, just a couple folks. Well, and this is the card that has made Blue Cross Complete one of the fastest growing Medicaid health plans in the state of Michigan. There's about 15 health plans, Medicaid health plans in the state of Michigan, and we're just one of them, and been around for about 8 years. However, here in Southeast Michigan, we've only been here with our contract in Wayne County for about 3 years. Excuse me, slide next. So just a few things I'm going to give you today, just a little information about us. And I know everybody's heard about Obamacare, Healthy Michigan, Affordable Health Care Act, whatever you want to call it. Now everybody has an opportunity to get health insurance, and aren't we glad about that? Yeah. I know I am. And then I'll just tell you a little bit about what I do as well. Now, as I indicated, we're one of the Medicaid managed health care plans in the state of Michigan. So you've got those other, I like to say, inferior health plans because we've got Blue Cross behind us, so we are number one. But if you see the map, there's the counties that we represent currently: Livingston, Washington, Wayne. So what does that mean? That means that I can do these kinds of things in Livingston, Washington, Wayne County. Because we don't have a contract to be in other counties at this time, we're pretty limited to where we are, but our growth has been significant. We're excited about it. We're consistently one of the top health plans with quality. We are currently ranked number 10 in the nation in quality. So what does that say? That means we are servicing the members that we have. We're giving them the good care that they deserve, and the doctors are taking care of them. Right now, we have approximately 64,000 members and growing. I've been with the health plan a couple of years, and when I got here, I think we were a little at 30,000 and some change, but thanks to the healthcare changes that have come along, we're now at 64,000. Wayne County is our largest. We probably have about 40,000 here in Wayne County, and then Livingston as well, and Washington. Excuse me, and as I indicated, we're growing about 1,000 members a month. We're the largest growing, so we're really excited about that. And that is because of the Blue Cross name, of course, but that's because we have quality physicians providing quality health care to members, and that is a requirement. And that's one of the things we're very proud of. So we know about the Affordable Health Care Act. So Healthy Michigan is the health plan that came out of Affordable Health Care Act. And that means any member or any prospective enrollee that does not qualify for Medicaid, which means they're under 130%, 33% of the poverty level. If they don't qualify for Medicaid, now they have the opportunity to go into Healthy Michigan. It is not that difficult. Everybody's blaming the president. It's the website. And we're still experiencing those challenges here in Michigan. And I'm not going to say they're problems, they're just opportunities for us to improve and to get better. So we're getting a lot of that population as a result of those that do not qualify for Medicaid. And here's some of the eligibility requirements. As I indicated, the age range is from 19 to 64. The income is below the poverty level, and I think for one person it's under 15,000. For a family of 4, it's under 30,000. I think those are the numbers that they've thrown out. But these members do not qualify or are enrolled currently in Medicare. The members, they haven't qualified for Medicaid in the past, so they're the ones that will be in Healthy Michigan. They're not pregnant at the time they make the application, and you must be a resident of the state that you're enrolling in. Now, you will receive one of the My Health cards, as you see that there, and then of course our wonderful health card is what they'll receive at the time once they're enrolled into the plan. And currently, what happened to a lot of the population, well, I'm not sure if you remember the ABW, which was the Adult Benefit Waiver Program, and those were the individuals that were just in Medicaid through SSI. They were transitioned in first into Healthy Michigan. So all of the, and from what I understand, I wasn't aware of the benefits that they had, but their benefits weren't that significant. And oftentimes that's a problem. Members A don't have the coverage, or they're not understanding of it. Now, a couple things that we did at Blue Cross when these members joined, we sent them out literature, and then we had some follow-up calls with a healthcare advisory team to call the members, because that's what everybody talks about, and we heard that they don't understand how to access the benefits. So we had individuals make telephone calls, contact them to tell them this is the plan that you have, as long as we have the appropriate information to contact them. And this is the health benefits that you have access to. So that was what we did with this adult benefit waiver population. And some of the benefits that our Healthy Michigan members receive that are outside of Medicaid, because Medicaid has a wide range of benefits. We provide transportation to and from the medical appointments. We provide glasses for the individuals. They have surgery access, they have routine health care. So all of those services were previously under the Medicaid umbrella. Now with the Healthy Michigan population, they received a few extra benefits. And it's the habilitative services, and it's, from what I understand, it's a different level of OT and PT that they're access to. They now, members have dental benefits. And one thing that we find out oftentimes, not getting good dental care results in poor health. A lot of things can be determined through the dental services. So the dental service care that they receive is through DenCap. And what we did at Blue Cross is we partnered with a vendor to administer those benefits, because they will build a network for us and they will manage that care for the members. And then also, hearing aids is a part of that new benefit as well, and that's for persons 21 years and over, where in the Medicaid program, they didn't have that previously. And so a few things that we, because how are these members going to be identified when they come in? They're not going to look like your regular, they will look like your regular Blue Cross members, but there's just a few changes that we added so that when the members came into the physician's office, they could be identified. And a couple things that we also were able to do, there's also a vendor that handles all the co-pays. So the doctor's offices don't have to get caught up in the co-pays and premiums and that sort of thing. That again is being managed by an outside vendor. So we try to, simply because we recognize this is going to be a growth process for everybody. There's going to be an administrative burden for a lot of the physician offices getting into primary care. I don't know if you realize it probably takes you, 3 weeks now to get into your primary care physician's office? Well, the growth that these offices are going to experience, that's the reason why we're taking on some of the administrative burden for those offices. And not only that, the state has also imposed an increase in the rates that we're able to pay the physicians. With the Medicaid reimbursement, it's very low. And you might hear, if you're ever in a doctor's office, you may hear the offices grumble about that. It's a low reimbursement, and we recognize that. So as a result of that, the state has given us an enhanced payment to pay the primary care physicians for a couple of years to offset a lot of this. So when our members come in, they're easily identified as our Healthy Michigan population. And this is again on the ID card. There is a code to distinguish who those members are. So, and again, it's only to identify them for reasons of, not for care, but for reasons of administration on co-pays and that sort of things. And this is the information that they receive. We have a provider portal with Blue Cross that our physicians are able to access to, again, look at this information as well. And now what I do is, first of all, I provide our education to our providers, and then I do community outreach like this, and build partnerships and work with the partners that we have at Blue Cross for the complete product. There are some requirements that we have to follow with the state of Michigan, but our effort and emphasis for the next year will be on partnerships. And that's what we're looking to do, because we realize communicating with individuals like yourselves to actually talk to our constituents and deal with the beneficiaries, it's good to work with you so that you can assist us in getting the word out. And then I provide information for our physicians on our newsletter, our portal, and then our website as well, going into the offices, and not only working with the physicians to understand how to navigate through Blue Cross Complete, but also how to work with our members. And that's pretty much my job. Thank you. And that's it. Is there any questions, comments? We all ready to tell the wonderful message about healthcare to everybody that we know? Well, I will be here till the end of the meeting. I have a table out front that has information that I'll be happy to pass on to you so that you can pass on to individuals you know. Like United Way said, it's our opportunity, or I think it's my obligation to make sure that we're giving the information to the individuals so that you that touch the folks that actually need the care, because oftentimes when I'm at events like this, they say, well, I don't really need it, but you do know somebody that it may touch. And that's what we want you to do. Again, tell the story. It's important. We are all, pretty much, and I'm committed, through Blue Cross to making sure we get the story out there. Like I said, many people didn't realize we had a Medicaid product. We have it. It's a great one. It's a strong one. And it's one that we are growing. So our growth isn't the problem. It is getting out to the partners and working with the partners in the community. That's what we relish and that's what we enjoy. So I'll look to you to help me do that. Thank you.